Hello, I'm Tucker Sheely. I'm going to be performing an adult physical examination. I just performed hand hygiene and now we'll go meet my patient. So could you please give me your initials?
BS.
Very good. Could you give me your date of birth?
6689.
Very good. And that makes you how old?
29 years old.
29 years old. And do you associate with being a male or a female?
Female.
Female. Very good. All right. So before this video started, we did take her vital signs, and her vital signs were as follows. Blood pressure was 106/67. Her pulse was 60 beats per minute. Her temperature was 97.6 degrees Fahrenheit. Her oxygen saturation was 96% on room air, and her respiratory rate was 12 breaths per minute. With that, we also did a height and weight on you. You measured in at 5'4", and you weighed 120 pounds, exactly putting you at your BMI was 20.6, and that puts you in the 7th percentile for US adult women. So we started with that. I also just kind of want to take a general look at my patient and see that she's in no acute distress. She appears to be pleasant and appears healthy at the onset of the exam. And so from there, I will ask you just a couple questions, kind of test your mental status. What is the date?
November 16th, 2018.
Very good. Who is the President of the United States?
Donald Trump.
Very good. And where are you located right now?
In Bacchus, Minnesota.
Very good. With that, I think we'll jump into the HEENT portion of the physical exam, starting with the head. And with the head, we will be assessing cranial nerves 5 and 7. So I will palpate the head, the scalp, assess the hair. Do you have any pain at all?
Nope.
Assessing for tenderness, assessing for any lesions or any soft spots, and looking at the face. Can you feel me touching on both sides of your cheeks?
Yep.
Very good. From there, I think we'll go to the eyes. So I will grab a pen light, my ophthalmoscope. So the first thing we will do here is test extraocular movement, and we will be assessing cranial nerves 3, 4, and 6. We will defer cranial nerve number 2. We will not do a visual acuity test right now. So first of all, can you look straight ahead? And now look at my finger, follow my finger with just your eyes, not your head. Very good. She does have a little bit of lateral nystagmus, which is normal. And now we'll test accommodation. Very good. I'm now going to take a peek at your eyes with the pen light here. If you could please look straight forward for me. Checking for pupil reaction on both sides, which appears to be brisk and normal. And now we will check the red reflex in your disc margins. So I'll have you look straight ahead, please, again. Red reflex is present, disc margins appear appropriate, as well as the background. Excellent. All right. After the eyes, we will now look at her nose. So I'm going to first look at the size and the shape of her nose, and then we will take a peek in, looking at her terminates, looking at the patency, and if there's any redness or irritation, also looking for a deviated septum. So I'll have you lift up your chin just a little bit. I'm going to take a quick peek here. Appear pink and moist with no noted irritation, small amount of mucus. After that, we will move on to the ears. So actually we'll keep the otoscope out here. Take a peek at the external ear first, making sure there's no obvious trauma, redness, irritation. Looking at the ear canal, and lift up here and check the tympanic membrane, which looks pearly gray. Small amount of cerumen noted. I'll take a peek at the right ear, assessing for any redness, any irritation. Look at the external ear, the ear canal, and then also tympanic membrane, a little bit more cerumen in that right ear, but the tympanic membrane appears intact and pearly gray. So From there, we will take a peek actually in your mouth and your throat. So with this, we will assess cranial nerves 9, 10, and 12. So I'll have you open your mouth if you can. Stick out your tongue and say ah. Very good. So with this portion of it, her mucous membranes appear moist, they appear pink. Her pharynx, it doesn't appear like there is any agitation or redness. Looking also at her teeth, making sure that her dentition is appropriate, which it appears to be. You also want to make sure that you're looking at her uvula, making sure that is midline. And then in addition to that, I also assessed her tonsils, which did not have any exudates noted. After that, we will take a look at her neck and assess cranial nerve number 11. And with that, first I'm going to have you turn your head all the way that way if you would, and now all the way that way. Very good. If you could look straight up for me, and now straight down, chin to your chest. Very good. All right, so assessing cranial nerve number 11. If you can kind of lift your shoulders against my hands. Very good. Good strength there. And then I'm also going to feel the neck for any tenderness, any lymph nodes, any masses, which I do not feel. So from that, we will then now move on to the respiratory portion. And so I will grab my stethoscope here. And so to start with, for the respiratory portion of the physical exam, I first want to just assess her skin, and then I will have you take a deep breath if you can for me. Very good. So I'm looking for symmetry. I'm also looking for whether or not she has labored or unlabored breathing. It appears as if she's in no acute respiratory distress, and her breathing appears normal. And so from there, we are going to defer the breast exam at this point, but I will check the axillary and the supraclavicular lymph nodes, assessing for any non-tender, non-mobile lymph nodes, which none were found. And so from there, we will go ahead and go to the back and assess for tactile fremitus. So what I'm going to do is put my hands on your back. If you could say 99 when I say so, go for it.
99.
Go for it.
99.
Go for it.
99.
Go for it.
99.
Very good. So assessing to make sure she doesn't have any signs of consolidation, and there's good vibration with that. I'll now do percussion to the back. I'm just going to move your hair just a little bit here. Making sure it's resonant. Assessing for any areas of, any dull areas. And now we will move to the front, and I'm going to listen to her breath sounds. If you could just give me a deep breath. Good. Again. Good. Again. Good. Again. 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 Good. And last one on the front. Very good. Now we'll move to the back. And a couple more deep breaths if you would. Very good. All right, so after the respiratory portion of the exam, now we'll move on to the cardiac portion. And so the first thing I'm going to do is actually just listen at the apex, the point of maximal impulse, and just get a kind of a general idea of the rate, the rhythm, whether there's any murmurs heard right away or any bruits. Very good. So that seems consistent with the pulse that we got at the beginning of 60 beats per minute. And so now we'll move on to listening to the cardiac areas. So starting with the aortic, we'll listen with the diaphragm and the bell. And now we'll move over to the pulmonic. We'll go down to Erb's point. We'll go down to the tricuspid. And lastly, the mitral. Sounded good, so I did not hear any murmurs, I did not hear any bruits, a consistent S1, S2, and from there we will move on to checking peripheral pulses to further assess the cardiovascular system. Alright, so we'll start with radial pulses. I will check your radial pulses here, you can turn your hands there, just checking for pulses. Looks good, they are palpated in both. Then we'll go to the brachial pulses. Same, they're felt in both. Check carotid. Very good. We'll move down to the femoral. Maybe just spread your legs just a little bit here. Palpable on both sides. Excellent. We'll move to the popliteal pulses. And lastly, the pedal pulses. Very good. Before we move on, I'm going to assess the carotids with the stethoscope and check for bruits. I'm going to assess it with the bell, and I'll have you hold your breath for me. Very good, let it out. And now hold your breath again. Excellent. So from there, no bruits were heard, and from there we're going to move on to the GI-GU portion of the physical exam. And for this portion, I would prefer if you could lay down. Very good. So the first thing with the GI-GU, I'm going to lift up your tank top just a little bit here. We're going to assess kind of the abdomen. We're going to look at the contour, the shape, the symmetry, and then also the umbilicus. Make sure there are no obvious hernias. From there, we're going to go ahead and auscultate the 4 quadrants. And so we'll start with the right lower, right upper, left lower. Sounds like she has normal active bowel sounds. From there, we're going to do a little light palpation, checking for any masses, tenderness, any rebound tenderness. And so just do a little bit of light palpation. Does that hurt at all?
No.
And now I'm going to do a little deeper palpation here. Same thing, checking for any tenderness, any masses. When I lift my hands at all, does it hurt?
No.
Very good. All right, from there I'm going to palpate for the spleen and the liver. So we'll try the liver here first. You can maybe feel just the very bottom of it here. Not easily palpated. And we'll attempt to palpate the spleen. which is not palpable on this patient. All right, you can go ahead and sit up for me. From there, we're going to look at the musculoskeletal system. And so you can kind of see by how she's moving, you can kind of get an idea of her balance and her coordination. But I think I will first have you stand up if you would. And go ahead and close your eyes, just assessing for balance. And then if you would, maybe turn around and walk towards that window and back, looking for gait, looking for coordination. She appears to have a normal gait. Go ahead and turn back around for me. We will now assess her spine and her back. So if you could go ahead and lean forward and try to touch your toes. Look at the spine. And it does appear as if she does have a slight deviation, which does look like it. You may have some mild scoliosis. Have you ever had a doctor tell you you've had scoliosis?
Yes.
Very good. You can go ahead and sit back up here. Again, at this point, we could assess the cranial nerve 11. We'll do the shoulder strength. I'll go ahead and have you lift your shoulders again. Very good. And now go through the range of motion in all of her extremities and then the joints. So first, if you want to just flex and extend your wrists for me, go ahead and flex and extend your elbows. If you could abduct and then adduct your shoulders. And then go ahead and lift your legs out. We'll extend those, flex those back in, checking the knees. And now we'll see if you can abduct your hip. You can pull that out to the side. Go ahead and pull it back in. Same thing on the right side. Very good. I'll go ahead and have you grab my fingers with both hands and squeeze tight. And if you could lift up your feet for me and push against my hands like you're driving a car. Do it one more time. Excellent. All right, very good. Now with that, we will probably move on to the neurological portion of the exam. If you could, I'm going to give you 3 words right now, and then at the end of this, I'll have you repeat those to me, okay? So the 3 words are ball, cat, and house. Can you repeat those for me?
Ball, cat, and house.
Very good. Can you name the last 3 presidents of the United States, including the one we have right now?
Trump, Obama, and Bush.
Very good. And what is today's date?
November 16th,
Very good. What year?
2018.
Very good. And where are you located?
Bacchus, Minnesota.
Excellent. If you can you close your eyes and reach out your hands for me? Okay. Can you feel me touching your fingers?
Yep.
Very good. I'm actually going to point to a finger now or touch one of your fingers, and then I want you to bring that to your nose if you can. Very good. Excellent. All right, keep your eyes closed and uncross your legs for me. I'm going to touch your toes. Can you feel me touching them?
Yep.
Very good. All right, stop. If you could you please repeat those 3 words that I gave you?
Ball, cat, and house.
Very good. From there, we'll move on to the deep tendon reflexes. So for purposes of this exam, we'll just do the patellar and the Achilles here. So go ahead and relax your leg as best you can here. All right. Very good. And then we'll assess the Achilles here. Go ahead and relax. From there, we'll move on to the integument system. Within this whole exam, you kind of have to look at their legs, look at their arms. You want to assess both the upper and lower extremities. We're looking for birthmarks, looking for abnormal moles, skin lesions, rashes. Do you have any irritations at all on your skin right now?
No.
Okay, very good. We will also assess skin turgor, so we'll do a little tenting test. So we'll kind of do a little pinch on the upper extremities. There's no tenting at all. Lower extremities, no tenting at all, which would indicate good hydration, healthy, supple skin. And then from there, I think we'll go ahead and look at you know, her abdomen, we looked at that already, we looked at her back, we looked at her feet, looked at her entire body. But we also want to take into consideration her hair, which I looked at right away. You want to assess for alopecia, thinning, and then also your nails. So if I could look at your nails again, you want to look for skin discoloration under the nails, any clubbing, which those look good, any signs of nail infection, which these look good as well. And so that is pretty much it for the integument system. I think from there I would kind of give just a general statement of what I feel how my patient's doing. You know, with your lungs, I was listening to those, it sounds like you had maybe slight crackles, a little diminished in the posterior sides, the bases of both lobes, both the right and the left lower lobes. And so from there, I guess I would kind of probably look into a different diagnosis differential of just the common cold or possibly bronchitis with this cough. Other than that, we have a fairly healthy patient, and yeah, that concludes my physical examination of an adult. Thank you.